In Africa, and as Africans, I know we probably know somebody, a parent, an uncle, an auntie, a grandparent, who probably has hypertension or high blood pressure, or we've heard of a doctor or somebody talking about high blood pressure and how bad it is, and then the effect that comes with it. So today on the TDJ show, we are going to talk about hypertension, which is high blood pressure. We say you have hypertension when you have persistently elevated high blood pressure. Now, what do we mean by you have a high blood pressure? The heart pumps blood to various parts of the body with a particular amount of pressure. Usually, we write it as a fraction. So we have the numerator and the denominator. For you to have a normal blood pressure, it's supposed to be 120/80, averagely. So we call the numerator the systolic blood pressure and the denominator the diastolic blood pressure. Now, we can liken the heart to the pump, let's say a pump that pumps water to an apartment. So the pump will pump the water with some amount of pressure. Now, assuming that there's a problem with the pipes or the filters and things that the pump uses to pump water, you realize that the pump will have to work with a higher amount of pressure in order to be able to distribute that same amount of blood. Now, in the body, we have the heart and we have the blood vessels. So that the blood vessels are the tubes or the pipelines that distributes the blood to the various parts of the body, and our heart is the pump. Now, it pumps to distribute this blood with an amount of pressure. Now, the normal pressure is what I spoke about. Averagely, it's about 120/80. Now, should we have a problem with our system, with our body, or with the system with which it uses that regulates this distribution of blood, then the heart will need to work with a higher amount of pressure in order to distribute that same amount of blood to the rest of your body for you to live. Now, when you have something like this, then we are saying that you have a high blood pressure. That means your heart is working with a higher amount of pressure in order to distribute the blood. So in simple terms, that is how I can illustrate high blood pressures to you. So when it happens like that, you realize that persistently your heart is working with a higher amount of pressure in order to distribute the blood. When you have this, or when this is going on with you, we say you have a high blood pressure, and this is what we call hypertension. Now, we classify this hypertension commonly. There's a form of classification. We have the normal one, we have hypertension, we have 1 and 2, stage 1 and stage 2. So when you say you are within the normal range, like I said earlier, that is 120/80. When you have 121 to 139, and then the diastolic, that is the denominator, is 80/89. We say we are in the range of pre-hypertension. In stage 1, that means you have 140 to 159, and then your diastolic, that is your numerator, is between 90 to 99. And then anything above 159, that is 160 on 100, we say you are in stage 2. That means you are entering the very severe range. So that is how we normally classify it. So when you are checking your blood pressure with these values, you know whether you are normal, you are in the pre-hypertensive stage, you are in stage 1, or you are in stage 2. Now, we have 2 types. We have primary hypertension and secondary hypertension. When we say primary hypertension, that means there's no underlying factor. It just happens that as you are aging or as life goes on, your heart is working harder due to 1 or 2 things, and we cannot pinpoint exactly why it is happening so. When we say you are secondary, your hypertension is secondary, that means that some sickness is happening in your body, and due to that sickness, you've developed hypertension. Now, in order to make the secondary bit more understandable, when we take the blood pressure, it is controlled by our brain. It's controlled by substances produced by the kidney, that's renal factors, and we have the blood vessels that forms the pump, those are the vascular factors, and endocrine. The endocrine part of the body produces certain hormones that helps to control blood pressures as well. Now, anytime any of these things are affected, it can make you get hypertension. And aside that, some diseases can also make you get hypertension. So sometimes kidney diseases, out of that, you can get hypertension. Endocrine diseases, we have a disease called Cushing's and others. can also make you get hypertension. When you have issues with your blood vessels, because the pumps, if your pumps are, your tubes, your pipes are affected, you can get hypertension. And then come to the brain. Neurological factors can also make you get hypertension. Other things that can make you also get hypertension: certain medications like NSAIDs, that is some pain medications. I don't want to go into those ones. And then other common medications like cocaine and other things we take can also make you get hypertension. Now, aside these diseases making you get hypertension, we also have risk factors of hypertension. So risk factors is not something that you like a disease, but things that predispose or increase your risk of becoming hypertensive. The fact that we are blacks already increase our risk of getting hypertension. Men, so male sex, they are more at risk than the female. When you stress yourself too much, when you are under a lot of stress, you can get hypertension. Okay, our diet, the fact that you are obese, very fat, puts you at risk. We've already spoken about certain diseases like diabetes already. Now, so lifestyle things like alcohol, smoking, sedentary lifestyle, not exercising enough, all these things are risk factors of hypertension. Now, how do you know whether you have hypertension or not? Most of the time, you wouldn't even know. That is why we call it the silent killer disease, because you'll be there, your pressures will be high, you wouldn't know, and you'll be there causing damage to your system. Sometimes you may have symptoms. You may have a headache, you may feel very tired, you may have a blurred vision, your heart may be beating fast or irregularly, you may feel like your heart is beating and it's very irregular. You may have chest pain, you may have some form of discomfort, you realize that you get tired easily. All these things are signs that your blood pressures may be high. It's not like specific to high blood pressure, but then it could be that when you're having these symptoms, you are having hypertension. So what do you do? When you go to the hospital, one of the things we normally do in every single hospital or healthcare facilities is to check your blood pressure. So when you go to the hospital, your BPs will be checked. Maybe you're not feeling anything. Maybe you are feeling one of these things. When we check the blood pressure, we will know whether it is high or it's based on the values I said earlier. Now, what do we do at the hospital? If it is a one-off value and it is not too high, sometimes it could be that it is just stress or because of a disease entity that brought you. So normally we don't use one reading to diagnose somebody as being hypertensive. We have some people that we say they have high cold hypertension. They are a bit anxious when they come to the hospital. Every time they come to the hospital, their blood pressures are a little bit high. But then sometimes when you come and it's a bit high and it is your first time, what we normally do is we try to monitor it over a period. So we can give you a chart that you go home in your normal environment where you are calm and you are relaxed. You can be checking, let's say, morning and evening for a period of 5 days and bring it back to us. So if on your normal routines, when you are not too tense and it's still high, then we can confirm that yes, indeed, you are hypertensive. But sometimes when you come, the values are so high that we cannot argue you are indeed hypertensive. That way we can just, tag you hypertensive or diagnose you of hypertension there and then. What we also go on to do is we do certain labs. You take your blood to do some analysis. We may do ECG, chest x-ray, other types of tests. The reason we do this is we want to know whether you not knowing you have hypertension, it has caused any damage, end organ damage. We want to check your kidneys, we'll check your liver, we'll check your heart and all that. We want to see whether there is something, a disease or something that made you get this hypertension. Or we also want to know your baseline. Now that you are hypertensive, what is your kidney function and what is your liver function? Because you're going to be on medications and all that, so that we can use it to compare subsequently. We need to have some form of baseline in order to monitor you from hands. So usually we will do all these investigations to get your labs. Now we will usually advise you, because the management of high blood pressure is on two forms. We have the lifestyle modification and we have medical bit of it. So lifestyle, what do? You have to reduce your salt intake, because taking too much salt can predispose you to having hypertension. If you are not active, you have to start exercising. If you are obese, you would have to try and lose a bit of weight. If you are, you drink a lot of alcohol, you have to reduce your intake. If you are smoking a lot, you have to reduce your intake. All those risk factors that I stated earlier, if you are doing any of them, you may have to reduce it. So we'll teach you and counsel you on all these things. Sometimes with some people, if it's not too high, with lifestyle modification alone, they are able to reduce their their pressures significantly. I mean, weight loss can actually reduce your systolic by about 10 to 20, so it is very significant. Now, aside the lifestyle modification, then we come to medication. Now, note that most of the time when we target hypertensive and you're on medication, you may have to take it for the rest of your life, most of the time. So we have to counsel you to let you know that you don't take it for just 1 month and stop. You have to know that when you're hypertensive, you have to take your medication for the rest of your life, because if you go off it, you may feel okay, but then it would keep going up. You may not know, and then it will just cause trouble for you. That's why we hear somebody just fell, the person complained of headache, fell, had a stroke, or fell and died. Most of the time, usually their pressures are so high, it causes a stroke, it causes an MI, and it kills them on the spot. You wouldn't want this silent killer to get you. So please, let's be in the habit of checking our blood pressures. Let's try and adopt a very healthy lifestyle. Eat well, exercise, do all we're supposed to do things in moderation like alcohol and smoking, so that we can extend our lifespan. Thank you very much. Don't forget to comment, to subscribe, and to follow. Put all your questions in the comment section and I'll do very well to answer them for you. Thank you very much.